My name is Sean Thomas, and I'm the author of Be More Today, a 40-day guide to a better version of you. As doctor of physical therapy, I've seen thousands of people do great things. They came to me with ailments, physical ailments, pain, issues, and they got through them, all because they decided in their mind they were going to do it. And I guarantee you, if you just trust the process and be persistent, you too can be the best version of you.
Welcome to the BMO Today show. Don't forget to like and subscribe to our show today. Now, let's hear it from our host, Dr. Sean Thomas.
What's going on, folks? Your boy again, Dr. Sean Thomas, back in the building. Be More Today show. We are back in the building. And folks, we are here enjoying the summertime. The summertime is real now here in the month of July, and appreciating all that summer has been bringing us. The Be More Today show has been live and alive as we be more alive in 2025. So again, thanks for love and support. This show is now in its 6th season, doing great things around the world, inspiring others to be more today. There were so many things happening in the month of July from our Steps of Greatness challenge. We have 102 people who are doing our challenge for this summer series. They're out there getting their steps in, and it's getting real now. We have some teams out there competing, people putting in their steps to be more fit, to be healthier. And I've had so many stories shared with me about the way that the Step Challenge has inspired them to be more consistent in their health and wellness. So shout out to all those who are doing the Steps of Greatness challenge. You can join us again for our next season, which is not going to be until the fall. But until then, for those who are out there stepping, keep on stepping. As you already know, BeMoreToday.com has all you need for my 2 books, Be More Today and Project More. Also on Amazon, and the show continues to grow in so many places now heard in 95 countries, over 74,000 downloads. Again, thanks for love and support. The show continues to grow. And shout out to our sponsors, Spy Belt, the best running belt in the world, as I always say. I love you guys, as always. Kim and her team is fantastic. Our sponsor, Jock Physical Therapy, the best PT clinic in the Northeast. And our monthly patrons for subscribing to the show every single week. It does not go unnoticed. Your love and support is greatly appreciated. Our quote for today is simple as always. An ounce of prevention is worth a pound of cure, by Benjamin Franklin. This week I did the most, and for whatever reason, my wife was out of town. She went to go see Beyonce. Shout out to her and Beyonce crew. All the way went to Atlanta to see Beyonce perform, and my daughter's at sleepaway camp. So I've been here, and I've been just grinding, doing so many things, being more today, being more active with my work stuff, my community work, hanging out, having a good time. And I realized that even in the movement of having more time or having less time, finding time to make sure you take care of yourself is crucial. And the prevention you can put towards that thing is priceless, right? The quote really says an ounce of prevention is worth a pound of cure. And I see it every day at my clinic, people coming in and talking about what they want to do, things they want to get back to doing functionally, what they want to prevent themselves from having to experience again because they went through trauma, went through a surgery, but not wanting to put that time and effort in to make sure that they can actually get that thing done. And yes, cures are fantastic. There are no medical pills, there are no magic pills, right? You can take. You need to be out there preventing these things from happening, whether it's stretching, whether it's strengthening, whether it's being proactive in terms of your wellness and your health, or just going out there and making smart decisions for your body. All these things can prevent you from having injuries that can be detrimental to you in the end. So the quote is poignant. And I said, who could I bring on the show today to talk about more things that we can be aware of, talking about prevention, talking about trying to make sure that we can live healthier lives, not just in terms of our physical lives, but also our mental lives, our capacity to interact with others, activities we're doing, and just regular things that happen in our everyday life. And I said to myself, I have the perfect person. His name is Rob Curran. Now, Rob is the injury prevention coordinator for the trauma center at York-Presbyterian Weill Cornell Medical Center in Manhattan, New York. He is in a position where it involves outreach and education to prevent people from needing the services of a trauma center, such as educating expecting new parents on infant injury prevention, including safe sleep, burn prevention, drowning, falls, head injuries, poisoning, car seats, so many things, baby-proofing your lives. He is in all these different things to help people be safer in their regular lives. educating teens and adults on the vital importance of wearing helmets every single time on their bicycles and scooters and skateboards. We see a lot of that in New York City. And educating older adults on fall prevention, wellness, and maintaining their independence. He advocates also for strong legislation for educating and regarding safer driving, which we know is very important all around the world, gun locks, safe storage, and flag removal. And he's been a long time medical provider and educator for over 20 years, teaching anatomy, physiology, pathophysiology, pharmacology, and other courses at the graduate and undergraduate levels in PA, PT, nursing, massage, podiatry, and sonography programs. He earned a BA in history and philosophy from University of Pittsburgh and a doctor of chiropractic from the University of Bridgeport. He has maintained a private practice in New York City, providing care to Olympic gold medal winning and professional athletes while maintaining a special interest in recurrent and poorly treated pain. Ladies and gentlemen, boys and girls, pets included, buckle up. We have our guest on the show today, my friend, my colleague, and we'll talk more about our relationship together. My guy on the show today, Rob Curran. Dr. Rob, what is going on?
Thank you for that 4-page introduction there, Sean. I really appreciate it. I'm sitting there going, yeah, I did that. Yeah, I did. Okay. Man, that took a while. Okay. I appreciate it.
No problem, man. I really
Great to
appreciate
see
you.
you.
And listen, it's good to see you too. And you've done so much, Rob. And I admire you. You've done so much in terms of your own craft, being a chiropractor, but also expanding that craft to so many other things and other places where you can really effectuate change in people's lives, not just in terms of what you were doing in your private practice, but also doing things with the hospital and with the community at large. And for those who don't know, uh, at Downstate, where I went to school, I've talked about my Downstate experience many, many times. You were actually one of my professors. And I've had a number of teachers I brought on the show talk about experiences that I've had. But one that I actually had to write in my book about, a chapter in my book about, was our interaction back in the 08, 09 time at Downstate. Now, for those who don't know, I took a class, a pathology class that you were teaching, and the class was a good class. You did your part, Rob. You did all you had to do, right? It was really me. I was in a place where, for whatever reason, I was doing dance stuff. I was focused on school, but I was still trying to just be, I guess, be more, but I was being
Be
the
more.
most,
Yeah.
right? I was being too much
You'll be more
and
everywhere.
be more everywhere. Exactly. And as I was taking your class and I was putting time and effort into it, but probably the minimum, not gonna lie to you, the minimum time and effort into it. Took the first test and got a 77, took the second test and got a 72. And passing at the time was supposed to be 78. So both of those grades were not going to be enough. Had to do a retake with you orally, an oral retake, which I had not done ever before. And as you remember, and maybe you don't remember, but
I remember.
I'm sure you remember.
I
Okay,
remember.
so I blanked for whatever reason. I blanked. And there are not many times when I don't have something to say, like some kind of word or some kind of something response, whatever. But you ask me simple questions about, frontal basal cortex, and I literally just was like, huh, what? What are you asking me? Like prefrontal who? And I didn't know what was happening. And maybe it was nerves, maybe it was um knowing that if I had not passed that test, I would not be able to move on in the program. Maybe it was just the preparation that was lacking, but for whatever reason, I was speechless. And I remember looking at you and you giving me this look like, bro, say something.
Say something.
Like use your words.
Yeah.
But I couldn't say anything. And I remember you saying, look, I have to fail you. I don't want to do this, but you're not going to pass this class. And I went home, talked to my wife or my fiance at the time. And long story short, I came back a year later, did the class over with you again, did better in the class, and went on to do great in grad school. But you are an integral portion of my grad school experience, and not in a bad way, but in the sense that you inadvertently became the catalyst that was needed for me to take my grad school experience seriously. And I worked so hard to get into grad school and all the classes and whatever else. And I think I got a little comfortable being in grad school, saying, you know what, I'm here. I'm just going to be able to coast. And I was doing enough to get by. But it was this class that kind of was the hiccup for me to say, okay, I got to be a little more intentional about the specifics of what's actually going on. So I gotta say thank you inadvertently for your patience with me during that period because it was somewhat challenging, but I think it really was a turning point in my career as a student to take this more seriously and to help others who also didn't either pass classes or had to do classes over again or whatever else. I've said so many stories of people in similar situations like this where they took a class, they failed, they came back, did it again, and they were so discouraged. But
Yeah.
I've been able to share with them, it's a class. You
Yeah.
come through, you do it again, you keep moving. So I just want to thank you for being so patient with me during that time. And
So
just want to share
you're one of the few who's ever said thank you for failing. I appreciate it. And I think, as you know, it was there's nothing to say. If you remember, I remember every second of it because it was excruciatingly painful to experience. I obviously knew you were talented, and I knew that you were doing many things, and didn't know you were destined for as much greatness as you've already achieved. But it was obvious you had a lock, you had something, and I remember going, Sean, I can't pass you. I can't be straight with the other students and let you slide on this. And you being incredibly gracious and kind of smiling and saying, I know, I got it. I'm gonna. I think you went on and continued dancing and continued doing other things, and like you had a plan, and then you were gonna readdress things. So I appreciate it, and I've taught for many, many years, and I know it's like in football and basketball, maybe you're familiar with like a coaching tree,
mm-hmm.
right? Where it says like Bill Parcells and he had these defending, now all these people are very successful. And I'm very happy to count you into sort of my teaching tree because that's how I approached education was I'm going to look at you as a colleague, as someone to refer clients to, as, if I have someone who's in pain or who needs therapy or who needs a diagnosis, I can't just send them into anybody, right? I want my colleagues and people who have initials after their name to be extraordinarily competent and gracious and have humility and be able to treat people appropriately. And you've accomplished all of that, and as well as influencing people in their personal lives and to be fit and to go on and to do everything and really be a model for a lot of people as we get into muscular fitness and muscular health and being a health professional as a whole. So I thank you for that. And that was part of my aim in education, whether it was PAs or PTs, nurses, etc. Is exchange. Here's my education. Here's my experience. But please do the best you can and treat people well. And it doesn't. We could talk for 30 seconds about bad experiences that people have being completely misdiagnosed or being and misdiagnosed might be a misnomer, like the doc just might not get it or you might present, but really being blown off and not listening to a person and not examining them worth a darn. And really it's right in front of you if you opened the book once or if you got taught. And that's what the purpose was. So not to waste people's time, get them out of pain, get them relief and on their way and independent, lead your own life without needing any further assistance. I appreciate it. I'm so proud of you.
Thank you, sir. And it's cool. We've done a number of things together over the years. I know we've done some work with you, and I want to talk about that. But I first want to just talk about your for a number of years, I was looking to have my own practice, do my own practice. I've talked about it in the back of my mind for a number of times. I've always talked myself in and out of it. I wrote business plans, and I was like, oh, not ready for that yet. But you have an extensive history of having your own practice, being a chiropractor by trade, and then you switch gears. I just want to kind of hear from you, what made you switch and what was the catalyst for you to say, you know what, this is great, but now I want to do something else, the pivot?
Sure. So I had a private practice with my best friend, and we were in Brooklyn. And we were doing well. I was doing well. I liked it. And it had been what what you train for, right? You don't go to school to do something that you don't like, hopefully. So one thing that had come up with chiropractic, being that it is a limited scope, especially in New York, is you do see pretty much the same stuff every day. Right. It's, there are different versions of it, but it's back pain, neck pain, continuous pain, etc. And even whether you're treating sports clients, you're seeing younger patients, you're seeing older patients, it's a lot of repetition. And you get as much as you want. You get really good. But there was one definitive moment that unfortunately threw me from private practice into looking for something else, and that was Hurricane Sandy. So in Hurricane Sandy, for those of you who are watching who are outside of New York City, pretty much significant parts of New York City went completely underwater. So in one fell swoop, my practice was underwater, my home was underwater, and my family's business was underwater in the same time. So kind of a washout. And lots of clients left New York City at the time. Lots of people were scrambling and had their own disasters. So that was one identifier that said, wow, this is a pretty big hit in private practice. But I had been waiting for a couple of years anyway. In grad school, I was granted the opportunity to adjunct at Brooklyn College and to teach summers as anatomy and then weekend anatomy, and had a great time in doing that. And teaching made me a better clinician, and being a clinician made me a better teacher. It just became a natural flow of having to explain muscles and bones to an 18-year-old or a 19-year-old student who had no background, and get them to understand it fairly quickly so they could pass an exam. And then you have someone who's experiencing, whether it's sciatica or a lumbar pathology or shoulder issue, you really got to treat them fairly the same way and go from zero to educated, or else you just become the hot pack exercise adjustment person. Mm-hmm. And they go around thinking that they have this pathology, and they hear about it from everybody else. And the herniated disc that they have, they associate with the worst herniated disc story that they hear from everybody, and they immediately need back surgery. And my mother-in-law never got better, and she was always in pain. Is that going to happen to me? Mm-hmm. And unless you educate them appropriately about their condition, they immediately tend to catastrophize and say, oh, my shoulder's never going to get better, I have to retire, all this stuff. Yeah. So educating them makes them a better patient, actually. And lets them know, listen, this isn't just 3 days a week of exercise. This is what's going to happen to your muscles. This is what's going to happen to your joints. And just like fitness, when you go to work out the first day, do you come home feeling great? Nope. Everything's sore. You don't want to get out of bed the following day. So the first week or so, everything's going to get worse. Yeah. Right? We're using muscles you haven't worked before. We're emphasizing muscles that have been asleep. Rehabs work, right? They call it for a reason. So being able to explain that on the weekends in class and then bring that to the office on Monday was a balancing act. And then you go back and treat and talk to the students and say, listen, this is what your future looks like. If you can master this now, and it's a common teaching tool, and it's really correct. If you can explain, if you can teach the next person, then you're ready to take the test. Yeah. Right. Don't just sit there on Quizlets and say, oh, I'm multiple choice. The name is B. And I would always pair up kind of the flailing student with the better student and say, listen, just explain it to them. You're going to get better. They're going to get better. Mm-hmm. And then the flailing student becomes more confident, and they see that it's a process. Mm-hmm. It's not that, and the things that we do, I don't think people have inborn gifts for. You learn it. You learn it by putting time in and putting in effort, and you might have a knack for certain things, but it's not that nobody can learn it except the top 5% of the people in the world. Right. And I think that's really important for people to learn, and that also influenced what I do today and everything else.
That's amazing. Yeah, and I know Sandy was insane for many people, and there are many stories of people in the same situation about pre and post Sandy. Kind of like pre and post COVID.
Yeah.
But, just amazing that you bounced back from that. And I've still found a way to do what you want to do the way you want to do it. And so be successful with that. So kudos to you for that.
Thank you. And this goes into, we talk about resilience a lot, with setbacks and listen, life doesn't really give you a whole lot of time to look back and sit back. And if you're not moving forward, time, just like the tide, time will take you out. So if you sit back and go, wow, I'm ruined, I can't do anything, you got to keep moving forward, and this comes back in injuries, in rehab. I can't believe I need a new hip when I'm 58. Yep. Well, now we're grateful that you're in a neighborhood in an area that you can get a new hip, because
Yeah.
in other places you can't get a new hip.
Yeah.
Let's get you the new hip and move forward and get you back into rehab and get you back on the squash court or bowling again or doing
Mhm.
what you could do.
Yeah, absolutely. Absolutely. I think a number of people are in that same boat, just trying to figure out next steps for what they want to do. And, when it comes to that population of people who are looking for new hips, new joints, new knees, etc., there's always a risk of falling.
Yep.
And you and I have done some extensive work, and I'm actually grateful that you've made me a part of the fall prevention symposium you've had over the couple of years. Can you talk to listeners about what that has been like for you, what the prevention symposium is, and how people can learn more about it?
Yeah, sure. So as an injury prevention coordinator at a level 1 trauma center such as New York-Presbyterian, Weill, Cornell, we're mandated to have injury prevention research and injury prevention into the community, which is one of the reasons why I accepted the job. It's great. So what many people might think about when they hear trauma center is shootings, stabbings, awful car crashes. And yes, we treat all of that. However, what most people don't know is the number one reason for a trauma team to be activated and the number one reason for a patient to be admitted for trauma throughout the United States and internationally is an older adult who has fallen. And with all the things that lead into that, right? Loss of balance as people age, people aren't working that back out. Osteoporosis, increase with the likelihood of increasing a fracture when they fall. Lots of people on quote unquote blood thinners or things that prevent them from making clots. So when they hit their head, we're now very cautious. Or if they've experienced, what may have been moderate trauma and go home, but now you're on medications that increase your likelihood that you're going to bleed.
Yeah.
So with that in mind, we really need to attack falling, right? Falling is not natural. It's not just, oh, you're older, so now you're going to fall. But there are a lot of different factors that go into it. And as you said earlier, an ounce of prevention, right, is worth a pound of cure. And as you said that, I sort of sat up in my chair, right? Because there's lots of things that look up at prevention. Why do I want to sit up in my chair? Because I realized I was slouching. So what's slouching going to lead to over an hour or two? Well, my back's going to ache and my disc is going to move backwards. And that's what we're talking about is, I kind of believe in a back bank, after you have a couple of exercises a day or a couple of bad positions. And once your balance is zero, you're going to start to hurt. So you protect it and add up and put into that bank, and then you're allowed to deduce and have some things. So we need to do the same things with lots of parts of health. Is it, building up calcium throughout the day and nutrition, especially in kids, versus fruit drinks. I don't want to name anything specifically, but instead of sports drinks and fruit drinks and things like that, do they need to increase their calcium so that we have a calcium bank? Because after 30 or so, we start to lose calcium every day from our bones.
Yeah.
And as much as the commercials might want to tell you to, if you're 60, start eating, calcium, that just doesn't work. It doesn't replace. So we need to have invested that earlier in our lives. And not many programs are talking to pubescent kids and teens about increasing their calcium loads to prevent what is called a geriatric disease, but it's really a pediatric disease, right? It's a pediatric disease with a geriatric presentation, which is osteoporosis.
Yeah.
So we do lots of different things in the community, balance programs, education about nutrition, going against frailty, increased strengthening, and really what you've brought as your hallmark when you gave your presentation is, we can have all these specific programs and named programs as you want. You need to move. We have these joints and we have these muscles for a reason, and it's not to watch Matlock for 5 hours. It is, you have to get up and be active. And I'm always amazed at your walking groups and your running groups. I wish I could get up at 6, but that's not how my life goes.
I know it's early.
It's just early. But that is part and parcel of moving and being active and staying independent and every day, we sign up for thousands of dollars in medications, yet every day, what tells us what prevents dementia and arthritis, and it's movement.
Mm,
It's and what increases morale. It's working together and joining a group and all the things that are positive.
yeah.
So what people go to the gym and they're healthier and they're stronger. Yeah, they're also saying hello to the same person at the front desk, and they're usually in the same patterns with the person in front of them who's doing a push down,
Hmm.
and there's human contact. Versus, unfortunately, what we see with a lot of people post 60 is they have two friends, three friends, maybe married, the kids have moved away, a
Yeah.
very isolated existence,
Yeah.
um, and that doesn't help anybody.
Yeah.
So there's a lot of things. There's a lot of spinning plates when we talk about how to prevent falls, which is what we don't want to see. Everybody on my team would rather treat an appendicitis than treat a 75-year-old who fell down the stairs.
Mm,
And just it's so hard to put all the pieces back together again, right? So we want everybody to live long, fabulous lives. It is nice weather out. Go for a walk. Go up the stairs. We also really want to prevent the limitations. It's not just about, oh, you take a nice stroll around the block. You and I both know, well, maybe they don't do more than you, but I know 70-year-olds who do more than me.
hmm.
And I know 70-year-olds who can do more pull-ups than I can.
Mm,
And people that, and I know, we just looked at like the Empire State Games, and there are 80-year-olds doing breaststrokes and breaking records.
right.
And that's what I love to see,
Yeah, it's wild.
right? It's not just, oh, can I walk and, can I do a little walk to the store? It's let's go. Let's do a bicep pull when you're 75 years old. Let's keep everything going as much as we can.
Yeah. Yeah, I agree with that. And you know what's funny? I 100% agree with what you just said in its totality. The movement thing is crucial. People need to just do it more. And I think the hesitation is multifaceted, right? People don't want to move because it hurts.
Yep.
But if you don't move, it's going to hurt more.
Yep.
And you mentioned Matlock. I actually, I
Not to
somehow,
throw Matlock under the bus.
no, no, no. It's funny because
Pick your show.
yo, no, great show. And they have the remake now
Yeah.
with
Kathy,
Bates. Yeah,
Kathy
Kathy
Bates. Yeah.
Bates. Yeah. So I was at someone's house today. I do a home care session every now and then, and a commercial came on for Matlock. And literally as I walked into the person's house, they were just, like you said, sitting on the couch, watching some random soap. I don't even know what it was. And that's just the comfort zone. That is literally the chair that continues to be in every house that I see, just people not wanting to move and feeling like, oh, I have to rest. It's going to be too much. I don't want to move anymore. But really, like you're saying, getting them to move in any capacity is ideal. And you provide the symposium for people to learn how to do these different things and how to really avoid the risk of falling. I have a PT of ours whose mom, 91 years old, fell and fractured her hip.
Yeah.
We already know how severe and crazy that can be and implications of that as we get older. So it's so important just to find different ways to, like you said, prevent. And you're putting out things out there so people can learn how to do these things on their own to avoid being in these positions. So I'm just grateful that I'm a part of that. And are there any more risk tips you can share? I know you mentioned exercise, you mentioned being more active, etc. But are there any other risk tips you can share with listeners who may be listening right now saying, oh, maybe that's me. Am I doing
Yeah.
enough to make sure that I don't have a risk of falling in my near future?
Yeah. So I think people need to be their own best advocate.
Mm,
Because I think, and it's our own fault. Medical professionals, I think we're fearful to encourage the older population to be very active
yep.
because they don't want to say, oh, we told this person and now they suffered an injury. Okay, well, you know
Right.
what? 21-year-olds suffer injuries too.
Right.
It's about being informed and being educated. And if you don't know enough about aging and mechanics and injuries, then refer to someone who does. There's lots of people who know what to do. And if you're just comfort zone with high blood pressure medications, then just do that. But say, listen, I also have a colleague who can do a couple of measures on you and get to know exactly what you need to do.
Yeah.
So you can lose 10 pounds. So that takes a whole lot of stress off your knees. So we don't have to talk about a knee replacement, and you don't have to complain to me that you need to go for rehab 3 times.
Right.
So in being proactive, one of the biggest issues that we have in U.S. healthcare is the fact that it's so fragmented.
Mm.
And when the older population now, if we go back one generation, they had a family medical practitioner who treated all of their problems. Now their family practitioner probably treats their blood pressure only and maybe, their cholesterol,
Mm-hmm.
but everything else is farmed out. They go for vascular somewhere else, they go for neuro somewhere else, they have cardiology somewhere else, and nobody knows what each other's doing.
Right.
And even, the computers were made so that you and I and everybody could share information and we could see what's going on with Mrs. Brown. But between firewalls and protection, we don't know what's going on with Mrs.
Right.
Brown. And I think it's important for people to bring in all their medications to their physicians or their pharmacist. I think pharmacists love to talk about medication. It's what they do for their entire life. And
Mm.
they know more about the side effects and everything than even physicians do. And say, listen, I don't know if you know this, but I'm on 3 drugs from cardiology and 2 drugs from neurology and my rheumatologist for the arthritis and this and that and the other thing. And when you look at it and add them together, they increase your risk of falling.
Mm.
Not by themselves, but between the cardiology drug and the other drug, they do have an increase in risk in falling, which
Right.
includes all the drugs that affect depression. Anything that affects your brain increases your likelihood of falling. How many older adults do we think have depression? A lot, right? That diagnosis has increased.
Mm-hmm.
Anxiety disorders, they increase your likelihood for falling. Sleep disorders. One of the biggest complaint in our older population is they're waking up at 4 in the morning or they can't seem to get to sleep. So drugs, things like Ambien, Lunesta, those are commonly prescribed.
Yeah.
And patients commonly might have a martini or something like that with it at the time, right? Or do something else. So there's lots of things where, or they've been on a high blood pressure pill since they were 50 and they're now 78.
Yeah.
Well, their liver is not 50 anymore, and neither are their kidneys. So maybe that needs to be relooked at.
Yeah.
And this is by no means in telling people to go off their meds and do all that stuff. It's bring things back to people's attention and say, listen, can we look at all these things and see if any of these now increase my risk of falling? I'm not 55 anymore, all this type of stuff.
Yeah.
Enough people are not getting checked for osteoporosis. And this includes, we can look at racial inequities, you can look at cultural inequities. We find people in the emergency room with spinal fractures and then find out that they haven't, been checked for osteoporosis. Well, obviously they have advanced osteoporosis if their spine is collapsing.
Mm-hmm.
And talk about prevention, right? This is something that we could have done with a test that takes less than a minute or so to check the bone density. But whether their docs aren't thinking about it or they haven't really gone to a doc, some people are frightened to find out what they have or what they don't have, so they avoid medical intervention.
Mm-hmm.
So this is like, and when we talk about community outreach and education, I'm trying to get out into places like beauty parlors. And most people are going to see their beauticians and get their hair done more than they go to a doctor.
Yeah.
So if we can get education out in the places where people are and say, hey, you're getting your hair done. When's the last time you had your bone mineral density checked? When's the last time you had your balance checked? Have you had your eyeglass? Your eyeglass prescription isn't meant to last for 10 years.
Yeah.
Right. Have you had an ophthalmologist really look and see, do you have a cataract that can be removed that's impairing your vision?
Yeah.
How's your hearing?
Yeah.
It's a 12-hour show, Sean, so we could be here all day. But there's just so much. Can you have, if you live alone or maybe live with somebody else, can you have somebody walk around the house with you objectively and say, these wires are not in a great place for you?
Mm-hmm.
Can we have a better light system at night that helps me get from the toilet at 6 o'clock in the morning to the bedroom, or all that stuff, night lights?
Mm-hmm.
There's just so many things that can be looked at. I have patients who are, in their 80s, and it's for the holiday season. They're going to reach up and get the one plate that they use for the religious holiday or for Easter or whatever, and end up falling off the step ladder. What are we doing here? Going up the step ladder after your 4 high blood pressure medications to get there's things that we can modify.
Yeah, absolutely. But I think your mindset and your vision for that is laser, right? Because you're focused on those things, right? You walk into a place and probably assess, what's safe, what's
Instantly.
not safe, instantly, right? The same way a mechanic probably, or like a engineer walk into my place and look around the building and say, oh, that pipe shouldn't be there, and that
Yep.
that So
Yeah.
you're wired that way, and I'm wired that way in some regards too.
Yeah,
But I
you
think
you 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 and I walk down the street and we look at people walking and we're looking
exactly,
at that person's got a flat foot, that person's got a
exactly,
high heel. In two
yeah,
seconds, we look
automatic,
at people differently. Yeah,
automatic. So when you mentioned going to beauty salons, beauty parlors, and mentioning that to me is revolutionary because now you're talking about, well, where are the people? Where are the conversations being had, right? The barbershops, the beauty
yeah,
salons, the nail places. Um, and even though it might not be the initial topic of conversation, it can definitely be instrumental because you're talking about people having a captive audience for at least a season or a
yep,
minute. So yeah, those things are fantastic. I'm always worried or weary that all these things are great, and prevention is usually the things that we don't put the most money into. It's
yeah.
usually the first things that are cut. So, to say, yeah, this is a great idea. Let's go out there and go to all the places and put this out there. And the powers that be would probably be like, yeah, that's cool, but who's paying for it?
Yeah.
And I guess my question for you now is, as healthcare professionals, how do we deal with that? I know we lobby, we go and we lobby, and that's great, right? But when it comes down to it, the money that can be put behind this program, even your symposium, right? Which is a great thing. I'm just imagining if that were on a bigger platform so that more people could be a part of it, how awesome it would be to have so many seniors or even so many whoever's listening to the information from the various healthcare professionals you have. And you have an awesome lineup on those things usually.
Yeah.
So, what could we do to put that on a bigger stage so that more people can benefit from that and be able to benefit from all the knowledge that's being shared from the
Yeah.
clinicians that are on there every single
Did
year.
did your check clear from the payment that you got for coming in?
I don't think
Yeah, I don't think that
it's
worked.
probably still in the mail. Yeah.
It was it's really, and this is why I love working with healthcare professionals, is because we get people to leave their practice, their money making practice, and come on for 15-20 minutes or so and share their expertise and share their knowledge. And I'm very upfront. It wasn't funded. I can't give you a stipend. I can't pay you. It's free. We're trying to get the information out there. And healthcare it's under attack. It's
Mm,
there's various different things, right, that are going on in healthcare, and trying to figure it out. It's difficult.
mm,
Um, uh, how do we address it? I'm not sure. I think healthcare professionals have ceded so much of their authority
mm,
and so much of their time to sort of being box checkers,
mm-hmm.
in fear of legal and in fear of electronic health records, that they've ceded a lot of their ability to do some of these things, and they just keep getting cut. I mean, I think it has to go back to refilling that passion box,
Mm,
which gets difficult when you have to pay bills at the end of the month.
facts.
Right. It's easy to say you're a doctor. You should be doing this for free. You should be,
Mm-hmm.
isn't it about your passion? Yeah, but my staff would like to buy a house too.
Mm-hmm.
And, the lights don't stay on automatically.
Mm-hmm.
So I run around. It is my passion. I'm going to keep going till the wheels fall off. So you can get me to go down to each of the beauty salons and hand out this stuff and put out my email, and I'll talk to you. I can talk to you till the lips turn blue. But it's very, very difficult. Money has to be put behind it.
Yeah.
It doesn't have to be billions of dollars.
Right.
I don't think practitioners aren't looking for billions of dollars, but the system's not built for prevention. It's
Right.
not. Your average primary care visit is under 6 minutes at this
Yeah.
point, right? I can't explain to you why broccoli is helpful in under 6 minutes.
Right.
All right. Never mind show older people how to do a squat, or talk to a parent about how do you talk to how are your guns hidden and locked away, or
Mm,
how to talk to your kid about, what's going on about, social. I just had a whole presentation 2 days ago from the Secret Service who came to talk to my kids about online protection and sexploitation, and who's talking to your kid on Xbox,
mm-hmm.
and what thoughts are they putting out. I'm like, 6 minutes. Yeah, there's no time for any of that. And that's
Right.
that one generation change from your family doc would explain whether the birds and the bees, and talk to, you go from the measles all the way up to osteoporosis.
Right.
But now it is so fragmented, things just get turned to somebody else.
Yeah. Yeah. We got a lot of work to do. Absolutely. Listen, Rob, you have some experience talking about prevention on so many levels. I want to kind of hit on some of them if we can, and maybe do like a rapid fire for some of
Yeah,
these. You talked about life-threatening bleeding. Now, in
yeah,
PT school, everything for us was tourniquets. Yep, tourniquet, 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 tourniquet. Right? That was like the only word that really talked about.
right.
But when rubber hits the road and things are really going down, what are some of the real tips that people should be listening to or adhering to when it comes to preventing life-threatening bleeding?
Yeah, so tourniquets are great as from professional responder point of view, and this is a generational term too. When I started getting into medicine, we didn't put on tourniquets. The theory was if you put on a tourniquet, you're gonna lose the leg, you're gonna lose an arm.
Mm,
And what we've learned more now, in especially since the early 2000s, and especially since lots of people were, being extraordinarily wounded in war, is that we could put tourniquets on for hours and hours, and the arms and legs would still be okay, at least in these very fit 18 and 19-year-old Marines and service people who are coming home. So, life-threatening bleeding, unfortunately, is still the number one cause of death for everybody from the age of 1 till the age of 44.
well,
Right? It's injuries and trauma, and we do all the math and add it all up. It's bleeding. So 2 year olds, they're more likely, unfortunately. I know it turns the show sad for a second, but 2 year olds unfortunately drown. That's their number one cause of death. And we're not talking about the ocean. We're talking about drowning in the house or or in a tub
mm,
or in the sink or in a mop. And then once you get to teens and crashes, et cetera, then we really look at life-threatening bleeding. So life-threatening bleeding stops in a couple of places where we can talk about prevention. Number one is if you happen to come across somebody who is bleeding or you're bleeding yourself, take your hand and put it on the place that's bleeding and push down with everything you got. Whether you're 90 pounds, 100 pounds, 350 pounds, push hard, push down, push now. And that'll typically stop the bleeding or at least give EMS and your response teams time to get there.
right.
Um, when we talk about life threats, all the things about being nice go out the window. Is it going to hurt? Yep, it's going to hurt. Is it going to, it is what it is. People are screaming. Wrap up a t-shirt. There's a lot of hesitation about putting bare hands and bleeding. I get it. But if, being going back and making sure we're addressing safety, put something between you and the hand and the bleeding part, but push down and push hard.
Mm,
Um, when we look at other parts, it's educating people about driving, educating people about safety, about um, personal behavior and personal responsibility, as well as who your friends are and who your peers are, who are going to tell you that you're too high and too drunk to drive, who are going to take the keys away from you, who
mm,
are going to defuse situations that you're in instead of pumping you up towards a confrontation that might not end well for anybody.
yeah.
So there's a lot of ways to take to prevent those things from happening.
Yeah. And those are all, I mean, that's all real talk, and that's all things that we should definitely be adhering to. And you just never know, right? You never know, especially in
Never
today's
know.
day and age, especially in these urban areas. I mean, there's so many times where things just pop off.
Yeah,
And we see it all the time. We see things happening on the train, especially in Brooklyn. Things just happen all the time. So being prepared for those things and knowing how to do it without getting panic and freaking out and being controlled in those environments, those are great tips. Those are great tips. You mentioned, and I know guns are a hot topic, especially in again urban environments like this. Although New York is not a carry city, we know there are guns around,
yeah.
right? So, I don't know who has, and no one really knows who has or who's carrying, but the number of shows we've seen, number of things we've heard in terms of adolescents getting their hands on firearms and safeties not being on, and young people injuring themselves or fatally injuring themselves as a result of the negligence on the parents' part or the adults' part. There's so many things we can just prevent in terms of these things happening. What are some of your thoughts and some of your tips on guns in general?
Yeah. So there is no way that we have enough time or anything to address the constitutionality or what
Hmm.
should we do with all the guns. So
Right.
let's just say they're out there, and what do we do now?
Correct.
You gotta if you're gonna have a firearm, and I don't even care whether it's registered or it's not, you have a firearm in your house, and it needs to be either have a gun lock on it, the safe message that we try and get to people is that if you're going to store a gun, the gun has to be in a locked place, separated from the ammunition. So the data really says that people have guns in their house because of the threat that at 3 a.m. someone's kicking open the door and running towards your bedroom.
Right.
The amount of times that happens is more on TV than in real life. Right. And I'm never going to talk to people about discounting their experience because someone's going to bring up some anecdotal story about how this happened once. It is much more likely that someone in your home is going to find the gun and injure themselves, perhaps fatally, or injure somebody that you care about, than you are going to take down a perpetrator. Right. So, and this doesn't say, well, I know guns, this will never happen to me, because the amount of sheriffs who have kids have found guns and killed themselves or killed their peers. These are educated people, like the veterans who come home, who are very comfortable with guns, who store guns in their home,
Right.
who either injure themselves due to, post-traumatic stress, or their kids find them. The videos and the data is very clear. Kids know where your guns are. Let's just put it out there. As much as you want to hide it, the kids know where your guns are. And it might be, somewhat innocuous when they're 5, but when they're 8 and 9, where they're going to find them, they're going to play with them. So if you feel like leaving the bullets around, then you're basically, you're as liable as everybody else.
Yeah.
They did there was a story. I was on one of the newscasts, and talk about bringing tears to your eyes. But it was a kindergarten class or a first grade class. And they brought in the police, and they showed kids guns, and they gave them a whole presentation. This is education, right? What are you going to do if you see a gun? Never stop. Call 911. Get an adult. Call the police. We would never touch a gun. Never do anything. And then basically they set it up and said, "Oh, we have to make a phone call." And the teacher and the police officer left the room. And within 30 seconds, the kids picked up the gun and pointed it at their own face with their fingers on the trigger. And we're looking down the barrel, and it's time to play cops and robbers. And then they would put down the gun. And when police and teachers came back in, they said, "Did you touch the gun?" They're like, No. I was going to. He was going to, but I never did, teacher. So education only goes so far. You can tell your kids not to play with the guns, and the guns are only for you as much as possible. But if they have access at all, then it's not going to work. The guns have to be stored separately, the bolt from the ammunition. Every time you buy a legal gun in the United States, you get a gun lock with it. Use those things. Take your protection classes. Do whatever you have to do. And it can't, it should be the maximum. Right? Do everything that you possibly can. The likelihood that someone's kicking down your door at 3 a.m. is just very, very low. Right? I'm not going to stand on a soapbox and tell people no guns everywhere. That's a losing fight at this point. I know it sounds weird. I have the same message if you're MS-13, if you're got a gun and it's illegal, and I don't care. Right? There's kids in your house. There's other people. Same thing. The likelihood is 3 o'clock in the morning. It's not going to happen. I don't care if this not just goes out to legal gun owners. Even if your gun's not legal, do you want your 2-year-old son dead? It's do something with it. Right? So
yeah, that's big. Hot topic number 3. I know fentanyl is everywhere, right? I mean, I've never heard this as much as this year in terms of the incidences of it being found in certain places. People are dying from it from the tiniest amounts in various places, and young people being exposed to it, whether they're doing it recreationally or what have you, it's everywhere. So, what are some of your thoughts on preventing this challenging agent, which again, it's hard to even detect, but it's something that clearly is deadly when it's around people in general. So what are your thoughts?
So we addressed this a couple of different ways. Number one, not really great, but it is what it is we do have a drug that's an antidote for fentanyl and for opioids. The drug is called naloxone, commonly referred to as Narcan. And that's a drug where if you get it to the person in time, it'll reverse the effects of Oxy, Percocet, codeine, heroin. It was really intended and marketed and used for years for heroin and morphine overdoses. Now fentanyl is much more powerful. You usually need to use much more. One of the reasons, in response to the fentanyl crisis, this drug is now over the counter, available as a little intranasal squirt that you use, sort of like if you put Claritin or an antihistamine that they use for seasonal allergies. And we hand this out everywhere. The city, the state, multiple agencies. I train kids in elementary school in how to use it. It is something that you can get over the counter from drugstores for free, pharmacies for free. If you just ask for it, they should participate. If there's a problem, feel free to let me know. And we've timed people, kids that we just, had in class the other day, 14 high school freshmen, high school sophomores, even standing there reading the directions while there's a mannequin in front of them took less than a minute to figure out how to do it and administer it.
Wow.
Which is life-saving, considering that even if they called 911 as soon as they saw somebody on the ground, it's going to take 7 minutes, 8 minutes for the fire department to get there, 12 minutes, 15 minutes for an ambulance to get there, right? So we want people to have naloxone, Narcan in their locker, in their car, at their house, at their office. Who's addicted to fentanyl? Who's addicted to pain and opioids? It could be me. It could be you. It could be the high school principal. It could be the baseball coach. There's no descriptor that says these are people who are exposed and who are taking fentanyl and opioids, and other people are not at risk. It's just not there. So having it on standby. I noticed you have a defibrillator at the practice. It's just like it, right? If you want to take safety seriously, then the libraries in Philadelphia have Narcan, and apparently, it is commonplace for them to find somebody who has shot up in their bathrooms and who is in need of resuscitation because they're public building, right? So that's one thing. Not great, but that's one thing. Education, again, I think super important, but education takes so long to change behavior. So you can't just rely on. That's why we have Narcan in case it doesn't work, but education up front. In New York, marijuana has pretty much been decriminalized, quote unquote legitimized, really not enforced, right? Unfortunately, what we see, and this started last year, when they arrest people for selling marijuana on the streets, not at the dispensaries, not at those places, but still marijuana on the street from a dealer, they test it. And last year, every test came back positive for fentanyl-laced marijuana. So you have marijuana. Every sample that they took from everybody arrested had the marijuana was laced with fentanyl. Okay. So when you see this sort of acceptance of marijuana, and if you don't think that kids are looking and saying, "Dad, it's accepted," the cops don't even arrest you anymore. It's just like having cigarettes, it's accepted. What they don't see is the life-threatening potential effects of marijuana, because marijuana now is not the same as the marijuana it was in the 1970s or 1980s. But having it laced with something that stops you from breathing is completely different. I have families come in to the hospital whose kids tried to buy ADD medications in college, right? They were studying for finals. They were overwhelmed. There's a black market, for those of you who don't know, about ADHD pills. And the ADHD pill, of course, was laced with fentanyl, and they passed away. And it's not a one-off case. Gummies laced with fentanyl, they look like gummy bears and all that kind of stuff. They're attractive to kids. All that stuff. So there's got to be a message about safety. There's got to be a message about not taking anything that's clearly marked as a medicinal, that's been tested, et cetera, because these things are out there, and these are, this is on college campuses. We try and do this, high school campuses, as kids are starting to experiment. Usually you're not getting a 16-year-old who's got something from a dispensary. Right. You got to see, right? So you got a 16-year-old who found something on the street, or whose brother gave it to them, or sister gave it, et cetera. And that's a huge education piece. Yeah. So it is just to put out there. Single grains can kill every kid in the classroom. Yeah. So and this is the baseline, right? This is how we know about chemistry. It's going to get even more potent, even more potent, even more potent, even more potent. So right.
Right. So, there are a number of dispensaries clearly around urban areas and around the world now. They're everywhere. They're popping up literally on every
Yep.
single corner and
Yep.
and in droves, right? Big ones, small ones, corner stores, whatever. You're saying, and this is not promoting or whatever, but I'm just talking about just prevention and safety. You're saying there are people out there who want to take gummies, want to use those agents,
Yep.
that it is safer for them to go to a place like a dispensary as opposed to just grabbing it from whoever they may
Yes,
see.
that's what the data tells us. The data tells us that there are safer places
Yeah.
than the guy on the street or the cell phone call.
Right. Right.
Um, and that's just where we are. And again, not to promote anything because I'm not in agreement on dispensaries hopping up everywhere.
Yeah.
I do think it's unleashed some
It
problems.
is unleashed. They're everywhere.
Um, so yeah, I mean, we were talking earlier about falls. We see the older population; their drug tests come back positive for marijuana.
Yeah.
We see the bicyclists and their and the mopedists and their drug tests come back positive for marijuana.
Mm.
And if you don't think that there's an impairment level, then you're fooling yourself.
Yeah. Yeah. No, that's big. Yeah. I wasn't saying, again, not to promote anything.
Yeah,
It's the same safe sex conversation that we always talk about for years on end, right? We're talking about
right.
condoms, not trying to promote it, but prevention is prevention. So
Yeah,
do what you want with it. But that's wild. I didn't know the statistics on that, especially the ones that are laced with fentanyl for just everything. I mean, that's scary. That's
yeah,
that's very, very scary.
yeah,
And I'm glad you shared that with the listeners.
yeah. And
Um,
and that's not even addressing the dangers to people who are out at parties.
right.
I know we just finished kind of like graduation, prom season, all that kind of stuff. And again, we go back to trying to surround yourself with good friends and good peers, because we know there are bad actors and we
Yeah.
know there are people who want to get things by any means necessary and who will have access and will slip these undetectable things into drinks and into products, just to see what happens, right? As if the quote from Batman is, some people just want to see the world burn,
Yeah.
right? So if you just want to see what happens at this party, if you get half the school high, and other people have more sinister things that they want to accomplish by using these products, and they can.
Right. 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 Final question for you about safe driving tips, especially in urban areas like New York City, Brooklyn, especially. You know, there are so many people, and I grew up driving in the Hudson Valley, upstate New York, so I grew up kind of in a different environment, bigger streets, not so many cars. So going from there, and then coming to the urban areas, I felt very, very prepared just because I knew how to, all the rules and whatever else. And I felt prepared being able to navigate the streets of Brooklyn and the bigger cities. But there's so many people who are growing up now, especially our younger people who just got their licenses. I have a number of cousins and relatives who just got their licenses recently. They're super excited to go on the road. And the distractions, we talk about cell phones, whatever else, but I'm just thinking back to Rob, when we were kids, we didn't have cell phones, but we had CD players. And I remember
Yep.
literally going through my CD,
Yeah.
like driving while changing a track on,
Yeah.
talk about, forget the cell phone.
There's always been
doing all that, right?
I know.
But I learned how to do it. We learned how to do those things. So,
Yeah.
what are some of your thoughts on, I guess, the modern day safety tips for driving for those who are out there on the roads today?
Yeah, I know. It seems to think like the safety message was that before cell phones, we were all driving around at 10 and 2.
Right.
And never doing anything and never applying lipstick and never
Exactly.
smacking the kid in the listen. My parents were quite distracted with me in the backseat of the car. Right. So for some, in some places where we've made incredible advances, child safety seats, seat belts, airbags, great stuff. And in some places, not so much. Right. So cell phones are, an incredible product, but for driving, not so much. So here, the one sentence is: put the cell phone on do not disturb, and put it in the back seat. Get to where you're going, and then put your phone off do not disturb. Just like I did when this podcast was starting, I think just like you did when this podcast was starting. If the podcast is important, then driving a 4,000-pound metal box at 60 miles an hour is probably more important. And if it's not important to you, My little boy crosses the street a couple of times a day.
Yeah.
It's really important to me. So, and this is, it's the circle of this whole conversation about why is gun safety important? Well, school shootings, the data tells us that those guns were taken from family members or stolen from cars.
Yeah.
Right, that most of these school shootings are not a kid going into a shop and buying a gun, is that they got it because it was improperly secured.
Yeah.
And if the adults did what they're supposed to do, then the person wouldn't have had access to this.
Mm-hmm.
And so when we talk about driving safety, it is the driver has to be responsible and sober and not drugged and not distracted. But then you have, and I, who sort of claim to be safer drivers, we need to hold our legislature accountable for enforcing harder and stricter laws. I listen. I know it's me. It's what I do for a living. But I equate guns and cars. And if this is your ninth ticket for speeding, then someone's got to take that license away. You are not safe to drive a deathmobile that you can get up to 110 miles an hour, 120 miles an hour, whatever, driving through the streets. As the students who are listening to us and parents and don't have the cell phone on, what are they supposed to do when the car comes over the embankment the wrong way?
Yeah.
Right? They are defenseless, and meanwhile, they have done everything that they're supposed to do.
Right.
So, as I said, education's great, but it has to be followed up by enforcement, by policy. I am such a big proponent. I am such a one strikeout guy with DWI and drug driving. If I give you the privilege of driving around and you get pulled over or you're involved in a collision and you are impaired, that's enough. I'm done with it.
Yeah.
You've given up your right. To me, it's sort of like if you shoot a bullet into a crowd and it doesn't hit anybody, do we keep giving you back that gun? Right? We don't just give you a ticket. That's attempted manslaughter. That's, all these types of rules. But if you break rules with a vehicle, we just sort of go, yeah, it's a process. Everyone did this growing up. We all drove through red lights and stop signs, and that's just luck. Right? And some of the stuff that we talked about earlier is life changes in moments.
Yeah.
Right. You were fine and healthy, and then the next step you fell and have a fractured hip, or the next step you went down the stairs. I had a gentleman come in and speak to my class a couple of days ago, and some of your listeners might know the name Jermaine Ewell. Jermaine is a black gentleman who at 17 was at a party in Atlantic Beach. They just graduated high school, got into a fight with a white kid, and the white kid was sort of humiliated, went away, came back with 4 of his friends, and literally beat Jermaine to death on the beach. Hit him with sticks so much in the head that he died and was resuscitated unbelievably, and has He eventually forgave his attacker, petitioned for him to be released from prison early, and they grew to be friends and got over it. They knew each other. They went to the same school. And his talk to the kids and his explanation to us was he had a couple of drinks and he stopped being, the guy's name is Shannon. He stopped being Shannon for less than a minute, picked up a bat and hit me in the back of the head and took away everything from me. Right. And then went back to being Shannon. But you can't take back that minute.
Right.
And you can't take back the minute when you're texting or making a TikTok and you fly through a red light.
Yeah.
And you can't take these things back when you look and you're looking for my gun and you don't see it and you go, wait a minute, where's my kid and where's my gun? So these are all moments that change people's lives forever.
Yeah, that's heavy, Rob, but it's real talk. And I appreciate you sharing that and the amazing, I guess, resilience, but also the amazing forgiveness of that story. Just really
unbelievable.
Me. I don't know. I always think to myself, if anything happened to my daughter, if, there was a driver who did something on the road and she, God forbid, was in any kind of accident, based on that, what I would do, how I would respond. I know how I should respond. I know what we should do.
Yeah.
But that's tough.
To actually hear it. I mean, I the second time Jermaine's come back and accepted an offer to speak to students, and I was in tears again.
Yeah.
I can't believe, and the interesting part is that neither can the students, which
Right.
is the life changing parts for them, which is when somebody steps on your sneaker, is it time to get into a fight about it?
Mm,
When when something happens and someone dismisses you, or whatever, or calls you the name, and
right.
it and it's hard to get teens, because every teens think they're immortal almost by definition, right?
Absolutely.
It's never going to happen to me,
Yep.
and I'm going to win every fight that I'm in, and I could kick this guy's butt, and I'm the and I'll take you to the emergency room. It doesn't work like that. So it's just moments, and to inform kids and have experience. It's hard to put a 40-year-old head on 15-year-old shoulders, but
Mm-hmm.
sometimes that's what you try and do, and
Mm-hmm.
just let them know, not every you don't have to go from A to inflamed in 2 seconds. If you took 3 or 4 breaths, your life's going to be different. Their life's going to be different. Everyone around you's life's going to be different. It's too much potential damage to fly off about things that really don't matter. I can't tell you what fights I thought I was going to get into when I was 19 that were so important to me at the time. They were life changing. I don't even remember them.
Mm-hmm. Yeah. Wow, Rob, you threw me off with that one, but I really appreciate you sharing it. And you've been so excellent talking today about prevention on so many levels. Any final tips you want to share with the listeners about the work you've been doing? Final tips on what we can be doing better as people, just to be safer for our friends, our family, or is there anything you want to share as we close out the show?
I think if they could subscribe to your podcast, I think they'd be did that's really the first step. Sean, I can't tell you. You're an inspiration to me. You even just taught your first intro. I'm like, man, I thought I was busy. Um, the stuff that you're doing is absolutely great. And I recommend hopefully you're listening to this podcast, walking around, enjoying a wonderful day
Mm,
outside with friends, making acquaintances, enjoying your life. And if you're not enjoying your life, hopefully you heard something today that will propel you into something that will hopefully help it a little bit more. Maybe you're going to have a chat with a healthcare professional. If your hips bothering you, your ankles bothering you, something's going on and you're not at your peak. Hopefully, maybe this caused you to make a change. And if you're aware that you have kids and maybe you have to have conversations or reevaluate where certain things are in your house, if you're planning to have kids, have some background, and to be able to make decisions and to be prepared for emergencies. But I think what you want, I think what I want, is for everybody to lead their best life and to have as much enjoyment of it as possible, as long as it's not hurting anybody else and they're doing what you're doing, and to do the best you can. And if I can be of assistance to people, and if you can be of assistance to people, I think we're more than out there. We're on the same team.
awesome. Awesome, Rob. Where can people contact you or connect with you on social media, the internet, or otherwise?
So I'm just going to give my email address, because I am not the social media superstar that you are. So my email address is ROC, like Robert O. Curran. It's not O is not the middle name, just there it is. ROC 9187 at NYP.org. Again, I work for New York-Presbyterian. I should put a little asterisk, Sean, that says that everything that's out of my mouth today is not a product of New York-Presbyterian, right? So it's all personal views today.
Yeah.
But it's easier just to get in contact with me from my work email. And if there's anything I can do for anybody, please feel free to reach out.
Awesome. We appreciate you, sir. You did a great job today on the show. Thanks for all the tips and the nuggets. And I look forward to working with you more in the future.
Absolutely. Thanks for inviting me on. It only took, what, 6 years?
Yeah, that's that's
4
definitely
years he
my
was going,
fault.
do I want to get this guy back on? Confronting struggles.
Exactly. We made it happen. We made it
Yeah.
happen. I
It was
really
a pleasure. Thanks so much.
no problem. And folks, please follow. I'll put his email in the show notes. So you can actually go on there and connect with him. I know he's also on LinkedIn as well, so you can always
Yep.
follow him on there. But just listen to all the tips. I mean, these are life changing, life saving tips for us all to be more and to really thrive in this life. There's so many challenges that we face that are outside of our control. So why make it even harder by making poor decisions? Let's be smart. Let's be safe. Best during the summertime. Take the tips that he shared in the show, share with others, share the show with others. And let's continue to be more alive in 2025. Thank you guys so much. We'll see you next time as always. Peace.